So I try to drape them when I can. It's not the end of the world, but most patients do. Now, Gluteus Maximus, the fibers, basically, there's a large attachment. You know, some on the iliac crest, some on the posterior iliac fossa, and some on the sacrum, and some on the sacrotuberous ligament. It's a huge attachment. So it basically comes from here all the way down to the ischial tuberosity area. But angles in this direction. Remember, they're oblique fibers. So we're going to, of course, strum this way, but this one is, if you can't feel the gluteus maximus. But remember, some patients may be neuro patients, and we're looking just for a trace. So atrophy sets in, and we're going through a lot of pasta to get to the meatball, so to speak. So some therapists will use their fingers like this. Some therapists will use their hand like this. But when you're really testing for strength, you can actually use your fists and simply push up into their glutes and say, squeeze your cheeks together for me. I know it seems weird, but that's all you have to do. If you get caught up in this action, then you get litigation. This is not so bad. Go ahead and squeeze. It's not so bad, but a lot of times it just seems weird. Let me poke you like this. So a lot of the manual therapists will be using their fists these days. Squeeze, and then okay. Because you want to see, is it a good contraction or is it not? Is one weak? Is one not weak? One stronger than the other. Gluteus maximus. Piriformis. Where is the piriformis attach?
Summit of the greater trochanter.
The greater, yeah.
Summit of the greater trochanter, that's the insertion, and it originates on the anterior side of the sacrum, correct? So it goes through the greater sciatic notch right to there. So it is a primary internal or external rotator in this position. External rotator. So let's say I'm doing this one. Normally I would test this side, but I'm going to try to do it on this side so that you can see better. When she does this, is that hip external or internal rotation?
Internal.
It's internal rotation. Do not get confused on the test. So I want her to try to do external rotation. So I'm going to relax. I'm going to try to push her outward. So she's going to try to meet my force and contract in an external rotation force. So I just put her in neutral and I say, don't let me move you. And I push in that direction. Good? Mm-hmm. So I have her in prone. I know where the attachments are. I say, Kristen, I'm going to have you in this position. I'm going to try to push your... Kristen, you don't know what I'm doing yet. Kristen, I'm going to have you in this position. I'm going to try to push you in that direction, okay? I don't want you to let me do that, okay? So let's try it. Don't let me move you. Relax. Relax. All right, don't let me move you. Okay, so that's what I'm going to do, Kristen. Is that okay?
Yes. All
right. Then I'm going to try to find the piriformis. Do I know where the sacrum is?
Mm-hmm.
I know where the coccyx is. It's right at that end, so I know the sacrum's right above it. I know my L4, L5 interspace, the heel of my hand. My finger is at the tip of the coccyx, so my hand is the sacrum. And that's fairly accurate if you have a large hand or a small hand. It's accurate enough. So I know it generally comes from this area, and as you can see, there's her sacrum that I drew earlier. So from the sacrum to the crest or tip of the greater trochanter, and I know how to find that. I go put my heel here, and sure enough, there's the greater trochanter. If I'm not sure about the greater trochanter, I can always internally and externally rotate. Oh yeah, sure enough, there it is. And there's the tip. So I know it goes from here to there. It's going to be right in that area. So I'm going to be palpating and trying to strum it perpendicular to the fibers. All right, so I place my hand there. I'm going to have to push deep because it's underneath the gluteus maximus. And I say, all right, Kristen, don't let me move you. And then I try to strum it. Remember, ooh, actually I feel it right there. And relax, relax, relax. There you go. I try to go a little bit deeper. Don't let me move you. Ah, there you go, nice piriformis. Anybody ever tell you that? Now, is it tender?
Slightly, actually. I mean, yeah.
Oh, really?
Just not too comfortable when you poke.
Well, I'm really poking deep, but it's not like, ow.
No, not out. It's just uncomfortable.
All right. So, if you can't feel it, which most of you will probably not be able to feel it the first time, that's a good thing. When it's problematic and spasming, and it's hard as rock, and when you touch it, it's very, very tender. Oh, that's the spot. How did you know? That's when you know you need to work on it. And then you can. Then it's easy to find. Then I just mark on it. Okay, it's right there. And then I'll do my ultrasound. I'll do my E-stim. I'll do my hot pack or ice pack, depending on what I'm trying to accomplish. I'll do my soft tissue, and we'll get into soft tissue spring quarter. And I'll work on it. Then I'll do my stretches and exercises. But if it doesn't stick out like a sore thumb and not tender, I mean, I was pushing pretty hard, but like that's not tender, is it? So if I go like that, oh, yeah, it's tender. That's how your patients will be. So if you can't feel it, say, well, it's fine. And so clinically, if you're not a great palpator, you didn't miss anything. Like, oh, I tried to poke around there. Any tenderness in this area? Remember, I checked here's PSIS, I checked the SI joint. Usually SI joint and piriformis problems go together. Not always. That's not tender, that's not tender. I don't need to worry about that area. Last but not least, the proximal end of the hamstrings. I know how to find the ischial tuberosity, gluteal fold, push in there. And I really want to find that, yeah, there it is, and then go just inferior to it and push down. Then I say, don't let me move you, and I pull her into extension, so she's trying to flex her knee, and it's a huge, look at that tendon, you can actually see it. Don't let me move you. It's that thick. It's huge. And that's our proximal hamstring. Now, we'll talk about this next quarter with hamstring strains. There's distal and proximal hamstring strains. So we want to find out, oh, I strained my hamstrings, well, what am I going to treat? What am I going to ultrasound? What am I going to E-stim? What am I going to do soft tissue? Good? So palpating